Hi, my name is Dr. Tina Ho. I'm a double board certified facial plastic surgeon based in Philadelphia. Welcome to my educational webinar where I'll be discussing my approach to rhinoplasty. In my practice, I specialize in structural rhinoplasty, which takes into account both form and function to the nose. Not only it's important to be able to create an aesthetically pleasing nose that's harmonious with the rest of the face, but also to create a nose where we have good breathing function. So with rhinoplasty, a number of issues can be addressed. I typically follow a top-down approach. First, what I do is I typically pursue an open approach to rhinoplasty. So this does involve an outer incision right here. Once the incisions are created and the nasal skin is lifted, I'll start at the top and address the issues that the patient is interested in. This can include a dorsal hump that can be shaved down here. Sometimes the nasal bones need to be broken as well, especially if we need to address a more crooked nose and to straighten it. I always feel like that addressing the nasal tip is the most difficult aspect of rhinoplasty, as a millimeter change can be a big deal to both the patient and the surgeon. So with tip rhinoplasty, this can include refining a bulbous tip, lifting a nasal tip as well, and it involves specialized cartilage grafting techniques, suturing techniques to achieve the result. In addition, I specialize in ethnic rhinoplasty. A number of these patients are bothered by the size and the width of their nostrils. So we can pursue an additional alarplasty or nostril reduction procedure where we create additional incisions here to be able to reduce the size as well as the flare of the nostrils. With rhinoplasty surgery, I place incisions between the nostrils via an open approach and incisions in the nostrils, so there'll be sutures there following surgery. I also place a cast on the outside of the nose as well. There will be bruising and swelling that will peak at about 48 hours following surgery. The patients will have the stitches and the cast in place for about a week. That's a great turning point for patients where we remove the cast, the sutures, they feel a lot more themselves again, and they can see a lot of the initial results, but with some degree of swelling and bruising there. Patients can then resume normal activity and exercise at about 2 weeks following surgery. More swelling and bruising has come down then as well. Patients feel most comfortable from a social standpoint closer to a month out from surgery, where they may feel most comfortable go to a wedding or out to dinner with friends, and they're seeing more of the results. Following that month out from surgery, then there's gradual changes with healing from rhinoplasty. Swelling in the nose following surgery can be controlled with measures such as taping, exercises, and steroid injections. And I ultimately tell patients that it takes at least a year or two, or even longer, for the nose to reach its final state following surgery. Thank you so much for taking the time to watch my webinar on rhinoplasty. Please reach out to our team with any questions. We look forward to meeting you in consultation and to helping you achieve your rejuvenation goals.